And finally, Mr. Daniele Zanotti, D-A-N-I-E-L-E, Z-A-N-O-T-T-I, who is the President and CEO of United Way Greater Toronto. Following remarks, we will open up to questions. We'll take a question from the floor here at City Hall, then we'll go online, and we'll alternate back and forth. Okay? Dr. de Villa, please.
Thank you, Brad, and good afternoon, everyone. As of 1 o'clock today, there are 161 confirmed cases of COVID-19 in Toronto, and 10 individuals are currently hospitalized. The new cases that we are investigating include a paramedic, a resident of a long-term care home, and individuals who are part of our shelter community. Since we learned of these new cases, we have been actively and carefully investigating each of these unique circumstances. We are collaborating with Toronto Paramedic Services, the Fred Victor Centre, and the Seven Oaks Long-Term Care Home. The paramedic who has been diagnosed with COVID-19 is currently in isolation at home. My team is actively investigating all possible contacts to assess potential health risks and will follow up directly with those who require further action. We have followed up directly as well with Seven Oaks and with the Fred Victor Centre to ensure that enhanced infection prevention and control measures are in place to protect our most vulnerable residents and the staff at these facilities. This includes enhancing cleaning and disinfection to reduce the risk of spread and protect vulnerable residents and the facility's staff. Signage on hand washing and infection prevention and control is also displayed throughout these facilities and other shelters and respites throughout the city. At this time, many people will soon be returning to our city from March break vacation or travel. Given our current circumstances, I do need these individuals to listen very carefully. If you are returning from travel, you must stay home for 14 days, even if you do not have symptoms of illness. And we're asking you to do this to protect yourselves, your families, and our community. This strong recommendation is made because people traveling back from March break are likely to have traveled through areas where COVID-19 is circulating. If you know somebody who's returning from March break, please tell them to stay home and help them to be successful in doing this. Be a good family member, be a good neighbor, or be a good friend. Pick up groceries or other household supplies for them and drop them off for them at their front door. We have a responsibility, we all have a responsibility to stop this virus together. I would also like to take this opportunity to remind everyone what we mean when we're talking about social distancing. Social distancing means working from home wherever possible. Social distancing means helping your employees stay home or helping your employees work from home. Social distancing means keeping 6 feet apart from others to prevent spread. Social distancing means staying at home and only going out for essential needs like food, medicine, or to pick up household supplies. Social distancing means ordering food through takeout or for delivery. Social distancing means purchasing your goods online where that's possible. Social distancing means participating in community or faith-based organizations, either virtually or by telephone. I know this is a lot to process. We are all trying to make sense of this while we are in the thick of this situation. People are understandably worried, and I suspect that many are lonely as well. We really do need to take care of each other. I'm encouraging everyone who can to stay home. Essential workers and those who support them need to come to work and maintain social distancing as much as possible in order for our city to work. I sincerely thank these workers. We should all sincerely thank these workers for their dedication and for their hard work. The rest of you, by staying home, will help these people to stay healthy and to keep our city working. Lastly, I'm pleased to share that in our most recent assessment of the compliance of bars and restaurants with provincial orders and direction, we found that 0.3% of the businesses we looked at were not in compliance. Only 0.3%. This is an amazing effort, and I sincerely thank our local business community for getting behind social distancing. In closing, I'm asking everyone again to make every effort and to take every opportunity to practice social distancing. Stay home, stay safe, and take care of each other. So with that, I'll now turn the podium over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. As you know, the City of Toronto has taken a number of actions to help prevent the further spread of COVID-19. City Hall, Metro Hall, and all City of Toronto civic centres were closed to the public earlier this week and remain closed. Non-essential city staff have either been reassigned to assist with COVID-19 efforts or, where feasible, are working from home. Employees who are presently working from home will be called in and/or redeployed to support essential or other critical city services as required. As always, the City of Toronto remains committed to providing safe, effective, and efficient work environments for all city staff. There are many roles and functions that are needed to support our collective efforts in responding to and managing the COVID-19 situation. The continued function of essential and critical city services is very important. Our city staff are committed to doing all that we can do to help. City services that continue to deliver normal service levels include all emergency services, including police, fire, and paramedic service emergency response. Toronto Water continues to ensure our drinking water is reliable, safe, and remains at the high standard we've all come to expect. Shelters and respite sites remain open. City-operated long-term care homes will continue to operate, but with no visitors being permitted at this time. Garbage and recycling collection will continue as scheduled, but yard waste has been suspended. Again, I'll remind you, if you have put yard waste out for collection this week, please remove it from the curb until further notice. Road operations, including snow removal services if required, will continue as normal. Toronto Hydro, the TTC, and 311 are all operating normally. The City of Toronto's Shelter Support and Housing Administration have initiated a number of proactive measures in support of individuals experiencing homelessness. These measures have been developed in accordance with the recommendations of the Ontario Ministry of Health and Toronto Public Health in order to ensure our shelters are safe for both our clients and our staff. These measures include the following. We have opened 5 new facilities in order to facilitate effective social distancing as recommended by Toronto Public Health. It is important to note that this is not net new capacity. It is temporary space to support social distancing recommendations. We have established one new isolation site for people undergoing COVID-19 testing. We have secured additional hotel capacity for the family sector. We have secured one additional site to shelter those who require 14-day self-isolation as a result of travel. Screening for both illness and travel history is being conducted as part of the shelter intake process, both by phone and in person. Anyone who is identified as requiring further health assessment through this screening process is being referred to one of the province's assessment centers before being admitted to the shelter. Routine infection prevention and control practices are in place and will continue. This includes enhancing cleaning and disinfection to reduce the risk of spread and protect vulnerable residents and the facility staff. We are engaged with both the provincial and federal governments in making the required personal protective equipment available for our community agencies. As well, additional funding has been provided to each of the community-operated 24-hour shelter sites to assist with the procurement of personal protective equipment and enhanced cleaning supplies. Signage that provides information and instruction on hand washing, along with infection prevention and control, is displayed throughout our shelter and respite sites. We have now secured a location for a new COVID-19 recovery facility for Toronto's homeless population, which includes wraparound health supports, and we are in the process of placing this facility into service. The location of this site is not being provided in order to ensure the privacy of individuals is protected. I want to remind everyone that our public health call centers continue to experience high volumes of calls. Many of the questions being asked can quickly be addressed by accessing toronto.ca/COVID-19. I encourage everyone to make the city's website their first point of access for credible and reliable information. All information related to city service levels, as well as public health information, is continually updated online. And once again, please do not call 911 when seeking information about COVID-19 or about city services. 911 is for use in emergency situations requiring the response by Toronto Police, Toronto Paramedics, or Toronto Fire Services only. As I advised yesterday, and officially communicated by the city this morning, Toronto can expect some unsettled weather today and into tomorrow, including the potential for heavy rain, high winds, and plummeting temperatures. City staff from Transportation, Toronto Water, and Parks, Forestry and Recreation, as well as Toronto Hydro, are on standby to address any flooding, icy roads, downed trees or branches, or down power lines, should that be required. As always, police, fire, and paramedic services are ready to respond to any emergency situation that may arise. In short, the city is well prepared, as it always is, to address emergencies. If you encounter a downed power line, stay at least 10 meters back, roughly about the length of a full-size school bus, and call 911. Our team at the Emergency Operations Center, as well as the entire corporate leadership team here at the City of Toronto, remains focused on keeping Toronto and its residents safe and well informed. I will now invite Deputy City Manager Juliana Carboni to address.
Good afternoon, everyone. During this emergency, we are committed to looking after the needs of our vulnerable residents. We are leveraging our relationships with community agencies to meet these needs, working closely with United Way and leaders across the community-based not-for-profit sector to better understand those needs. We have convened groups that include representatives from community agencies and many city divisions to share information, to identify new and emerging issues such as food insecurity and access to services, to develop effective responses, and to work closely with neighborhood groups to connect and support agencies. We are also working with the Toronto Aboriginal Social Services Council to ensure that we continue to meet the needs of our Indigenous communities here in Toronto. We know and acknowledge that our community partners are responding in every way they can to support vulnerable Torontonians during this emergency. They are working hard with staff, with volunteers in the city to keep their vital services available to families, seniors, and people living alone. The distress line and many other agencies are keeping helplines open so that residents can call in. Access to food is a major issue for low-income residents and families, and the city is working with agencies to understand which food banks are still operating across the city, where the gaps and needs are, what solutions might be. We are identifying food banks that are being closed so that we can work together to find ways to keep as many of these essential services opened as possible. And we are grateful to our corporate partner, Loblaws, who has joined our efforts, providing much needed donations in food and other supplies and supports. Access to childcare is another challenge that has been discussed by the City Community Response Table. At the press conference today, the province confirmed that Cabinet is discussing this afternoon the feasibility of emergency childcare. As we wait for further direction from the province, planning here at the city continues. For residents in need of social assistance, Toronto Employment and Social Services continues to ensure the provision of critical financial supports and benefits for low-income residents and vulnerable Torontonians. New applications for Ontario Work Financial Benefits can be made by phone. Residents can call 416-338-8888 to apply for assistance. City staff will also provide information on how to access the additional benefits that were announced by the Government of Canada on March 18th. Seniors, we know, will be especially vulnerable during this period. The city, through its supportive housing program, continues to provide essential support services to seniors enrolled in the program and living in the community who need assistance with personal care, with medication reminders, and safety checks. And our partners at Toronto Community Housing are supporting seniors and vulnerable tenants with targeted check-in phone calls, connecting tenants to appropriate community supports, providing information on COVID-19 and how to stay safe, and increase cleaning and disinfection. Anyone who needs information on social and community services that are available can call 211. 211 is a 24/7 helpline and web service that's been connecting people to social services since 2002. As you know, this is an evolving situation, and we will continue to work closely with United Way and our community partners on effectively responding to the needs of vulnerable residents. I cannot stress enough the importance of these partnerships. Community groups and agencies are in the communities, and they hear and see firsthand the needs and the concerns of residents. As you will hear from Daniele Zanotti, the President and CEO of United Way of Greater Toronto, working closely with our community partners is critical to supporting vulnerable residents quickly and effectively. I want to thank, on behalf of the city, the many dedicated community groups and agencies and the people behind them who continue to support vulnerable communities every day and throughout this crisis. Thank you, and I'll now welcome Daniele to come and say a few words.
Good afternoon. As the largest investor in social services next to government, United Way stands with our city partners to ensure Toronto's network of community agencies can support the most vulnerable in these unprecedented times. Because we know people who already face significant barriers, poverty, homelessness, social isolation, need help now more than ever. And we know community connections matter, especially in times of crises. Research shows that the stronger the sense of connection, citizens, agencies, government working together, the more resilient the community response. We need our social infrastructure, that invisible network of agencies that people visit, rely on, call every day in your neighborhood across this city. We need that social infrastructure today and for decades to come. This is why United Way is partnering with the City of Toronto, connecting our frontline agencies to activate 10 community tables by geography across Toronto neighborhoods, and 2 community clusters, one convening Indigenous agencies and the other for citywide organizations. These community tables continue the important work United Way and frontline service agencies deliver every single day in this city, supporting people experiencing poverty. And we are already at work, identifying gaps, needs, and opportunities that are emerging locally, helping agencies navigate change by offering them flexible funding so they can do what they do best, meet urgent needs. And our frontline United Way agencies are already working in new ways, reaching out to that mom struggling with mental illness via a text and online counseling, just to make sure she's okay. Providing service and street outreach for our homeless population. Making sure that personal support worker can make a safe visit to your 92-year-old neighbor. And helping that young woman with developmental disabilities in a group home get to her medical appointment. We are best positioned to respond, to succeed when we work in a united way. Thanks to the City of Toronto for immense leadership on this comprehensive community and social services strategy. And thank you to all the frontline staff and volunteers in United Way's network of 270 agencies across this region, Toronto, Peel, and York, working tirelessly behind headlines and cameras to ensure that the people who already face significant barriers, poverty, homelessness, social isolation, get the help they need, now more than ever. Thank you.
Thank you, Daniele. First question? We'll take the first one from City Hall. Mark Douglas from 680 News.
Dr. de Villa or Chief Pegg, whichever one of you feels it's most appropriate
Sorry,
to
I
respond.
should have cleared. If you could just ask who you're going to ask your question of, they'll come up to the podium, and then we can have Dr. de Villa, then Chief Pegg, if you like, Mark.
Let's do it that way. Dr. de Villa first, please, and Chief Pegg, if you want to follow up on this, great. Regarding specifically the paramedic who's been confirmed to be infected, did that paramedic catch the virus on the job? Were they returning from Vegas? Were they in close contact with someone who was traveling? Without revealing any personal details, can you tell us how that paramedic became infected?
So you're right. I won't reveal any personal details, and I've addressed this audience before that I don't discuss case details out of concern for the privacy of the individuals. So at this stage, investigation is underway, and I'm not prepared to share any further information in respect of that case.
Chief Pegg, I assume the same response? Okay. And a quick logistical follow-up then on the total number of cases. I mean, you're saying 161 now?
That's correct.
Just a few hours ago, the city sent out a release saying that the total case count was 153. Can we get an explanation of this discrepancy? And I'm going to take your numbers as the most up-to-date, but why is there a discrepancy between your department and City Hall?
So I'm going to suggest to you that you do take my numbers as the accurate numbers.
If you do say so yourself.
If I do say so myself, and that was as of 1 o'clock today. With respect to the earlier data that might have been provided by the city, it all depends on what time the data were pulled. right? So when you pull the data, actually determines what you're going to get from the system. The situation is constantly evolving. I think you've heard many of us talk about the situation is one that is rapidly evolving, in fact. So it's all a question of when the data are actually accessed. So as of 1 o'clock today, 161 confirmed cases.
Okay, we take a question online then to Denise from Reuters, please.
Yes, hi. We're seeing reports that there's an officer from Toronto South Detention Center who has tested positive for the virus. Can you confirm this, or can you give any details about this without giving out personal information?
I'm afraid I can't speak to the individual circumstances of the case. So
Can you confirm this?
no, I'm afraid I cannot.
Okay.
You have a follow-up, Denise?
No.
Okay,
Thank you.
thank you. Christina from CP24.
Hi, Dr. de Villa. Before I ask you this question, I want to clarify that we asked Health Minister Christine Elliott about today as per the advice of your office, and her answer was she's been having conversations with you, so hoping you can clarify. So people have been telling us in the last few days that they can't go to the assessment centers to get tested unless, of course, they've had travel history, had been the criteria, at least most recently. Now we understand, according to actually the City of Toronto's website, that may have changed. The algorithm may have changed. So if you confirm that the algorithm is now based on the recognition that community-based transmission is present in Toronto, and you no longer have to worry about having travel history to get tested at an assessment center.
So what is on the website is in fact the current state. And what I expect clinicians are doing, as they always do, is to assess the individual situation and make determinations premised on what they see and what they obtain from patients as the history. That's how clinical assessments should occur.
Okay, thank you. And a question for Chief Peg, please. So of course, Chief Peg, we've been talking a lot about social distancing. Wondering if you can comment on these two items of social distancing. One, wondering if you've seen the images outside of EB Games in the city. The mayor commented about this, the premier. EB Games has not gotten back to us. I mean, are bylaw officers going to attend that location? Will they be fined? Also, next door, the murder trial regarding Kaylin Schlater is taking place. We understand the jurors are all sitting next to each other in the courtroom. The courtroom has, according to our reporter, there are more than 50 people. Apparently the jurors were advised, you know, if you're not comfortable, you don't need to sit beside each other. But again, these are not examples of social distancing, even in a city facility.
So I'll start at the second one. So I'm not aware of the situation with respect to the jury trial, so I'll take that back. With respect to the circumstance at EB Games, we are aware, and I can confirm that that information, once it was received, has been fed into our Emergency Operations Center, and as we've explained before, there are representatives from all of our essential service and partner agencies in that within that network. So we're aware. I would say that it has come to our attention, and we are working through the process of determining what the appropriate response to that situation is. And I should say, it may involve enforcement. That's yet to be determined. But I think first and foremost, as you've heard Dr. de Villa say repeatedly and throughout all of these briefings, the most effective means is one of education and in achieving public support and compliance. I think Dr. de Villa and the public health team have been crystal clear with all of us with respect to what social distancing is, why it's important, and in fact what it is not. So my advice, I would reiterate, you know, notwithstanding the fact that we're aware and we're continuing to look into that specific situation, I just want to reiterate the advice Dr. de Villa has continued to give. We need to be no closer than 6 feet. We need to protect the principles of health protection that have been provided to us by public health. And we need to do that with an understanding that we're not only protecting ourselves, but we hold a social responsibility for protecting our families and the people we live and work with. So I can say that in my capacity as the head of emergency management and as the fire chief, it simply is my expectation that all of us are doing our very best, and that includes everyone on the street, on the sidewalk, everyone that is going about their daily lives, meeting I guess, picking up their necessities and in this case, what appears to be shopping. So I would add my voice to Dr. de Villa's message. The responsibility really does lie with us. With respect to following up specifically, I would say that that's ongoing within the EOC.
Okay, we'll go online now. Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
For Dr. de Villa, please. Dr. de Villa, can you tell us if the person who tested positive in the shelter system was screened, and if not, how they were identified, and if any other clients or staff from that shelter are now in isolation?
So I'm sorry, I just want to clarify the question. You were asking if the shelter client was screened and
if any staff or clients were put in self-isolation as well as a result.
So with respect to the shelter client themselves, all the protocols were in place at the shelter, and so that would have included screening as that person approached the shelter or was checked into the shelter is perhaps the more appropriate term. With respect to what else is happening at the shelter, my understanding is that we are conducting the investigation there, and there are some individuals who are under investigation. So we will proceed with that investigation, and I'm happy to provide updates as I have more clear information.
And just to follow up, I think for Mary Ann.
For other media here, just Mary Ann Bedard, General Manager of Shelter Support and Housing.
Hey, Marianne.
Hello, Jennifer.
I just wondered, the 5 new facilities that were mentioned that are now open, is that enough given that the permanent system is at capacity? And what else is planned to try to increase that number of additional spaces?
Yes, well, as I said in my comments the other day, we continue to look at this evolving situation, and we will continue to revise our operational plan as required. We continue to talk to our community partners and ask them what support they need. And so we will continue to be nimble in our response and change as we need to.
Okay, thank you. Matt Bingley from Global News.
Questions for Dr. de Villa? Just wondering, the individual who was tested positive in the long-term care home, again, I know you can't give out specifics, but I noticed that in the city report, city release, it said that you're working to contain an outbreak in that facility. Can you tell me how many other individuals have been tested there, and if any of them are showing symptoms?
So, the term used is outbreak, and that's because we have a case of COVID-19. So that's exactly what the outbreak is. And so all the measures are put into place in order to manage the spread or to prevent the further spread of disease within that facility.
So has anybody else there been tested, though?
Well, the investigation is proceeding, and those who develop signs and symptoms will be tested, but I can't speak to the specifics yet at this stage of the game. I'm sorry.
Can you just follow up and just provide a little bit more detail into what the next steps are to make sure that this doesn't spread beyond one individual, and where that I think I saw that individual was isolated, but were they taken out at the facility?
So I'm not going to speak to the
Sure.
individual
Yep.
circumstances of the case per se. However, outbreaks within the context of long-term care homes is in fact the bread and butter of local public health. And it is the area, one of the key areas within which long-term care providers and public health have regular interaction. So there are very well-developed, extremely well-developed infection prevention and control measures and outbreak protocols that are in place for long-term care homes. Admittedly, COVID-19 is a new disease, and it comes with an extra degree of anxiety and fear associated with it. But we do know about the disease, we understand more and more about how it's transmitted, and we therefore know what appropriate measures should be put into place in respect of managing a case of COVID-19. And I am 100% confident that my staff we're working well with the long-term care home providers to ensure that every measure is being taken.
Okay, I think I saw Gord McKechnie. Can I ask you a quick question?
Gord McKechnie, who's the Chief of Toronto Paramedic Services.
How you doing? Nice to see you. I'm just wondering, in relation to your service member who has tested positive, can you tell us if they were on the job when they contracted this, and if you have any concerns going forward for any of your members based on this now?
So I can tell you that the paramedic contacted us on March the 19th. That paramedic was in contact with public health, and as Dr. de Villa stated, that paramedic is following that protocol and instructions. As to your second question, I'm not concerned. Our paramedics are extremely professional. Their personal health and safety is is our most important aspect of responding to the public's needs in emergency settings. And I'm not concerned about the level of current service delivery, and we'll move forward. It's an evolving situation.
Do you feel like you have enough equipment to maintain them safely?
Yes, I do.
Okay.
David Ryder from the Toronto Star.
Hi, for Dr. de Villa. Dr. de Villa, when you expanded your advice to non-essential businesses, and I asked if that would include the possibility of prosecution, as you said, with restaurants and bars, you said you wanted to wait and see how compliance was. And then we have a lineup of people at Eaton Centre in fairly close quarters waiting to get a new video game and the store being open. Are you contemplating, does that make you think that prosecution for that is more likely? Because it seems right now under the provincial rules and your rules, that store isn't actually breaking any rules.
Well, I think we've heard from Chief Pegg that there's an investigation, an assessment that needs to be done in respect of that situation. You know, I'll tell you, I'm disappointed, right? I'm disappointed in the business owner. I'm disappointed that that sort of crowd was allowed to build, and that it doesn't line up with what we expect from those in our community who are interested in protecting and strengthening our community. So I trust that the business owners of in that case will rethink their approach and hopefully get behind social distancing.
And follow-up question is, I think you, as always, are calm and measured. I think when a lot of people got a press release saying a person infected, a paramedic, a person in a long-term care home, and a person who experienced homelessness, a lot of people felt a pit in their stomach. So can you give us a big picture? Is this just totally expected, or is this cause for concern?
Well, I think we have always been talking about the expectation that we would see some degree of community transmission, and we're talking about members of our community. So this is anticipated, and I think we've tried to make sure that our community was prepared for this eventuality. I realize that it is difficult to hear, and it's difficult to think about the fact that some of our most vulnerable residents in our community are now affected by this. But that's why I would again go back to urging members of the public, including members of our business community, to get behind social distancing, to protect themselves, their families, and yes, other members of our community, including those who are members of our most vulnerable.
Lightfoot, CTV.
I'll start with Dr. de Villa because you're up there. We're getting calls and emails from construction workers who are concerned because they haven't heard anything about what they do. They work in close quarters, be it outside, but quite often just by the nature of their job, they are within 6 feet from each other. Are there any plans to address the issue of the construction industry? Obviously, financially, people would like it to keep going, but from a public health point of view, what can be done?
Well, I think from a public health point of view, we have to look at all aspects of what it is that contributes to health in our city. And certainly understanding what keeps the city running, right? Maintaining, important aspects of our economy, because frankly, the economy is crucial. It's fundamental to health. So is managing the current COVID-19 situation. So what we're trying to do is strike this delicate balance between these two things. But at the end of the day, the overall goal is promoting and protecting the health of the residents of this city. So regardless of what the essential, activity is, if this is deemed to be important enough and essential enough in terms of continuing the functioning of the city, still I would try to encourage social distancing as much as possible.
My second question would be for Marianne, if that's possible. The other day you walked us through fairly detailed what the city's plans were for when this came to the shelter community. Can you just sort of talk about what actually happened? You mentioned the other day that if someone was showing symptoms, they would not be admitted to a shelter. Is that the case here, and that the person was not actually admitted? And then can you sort of walk through what will happen next? I understand there's an isolation facility, but I'm guessing there's some sort of investigation. You'll have to be looking at who this person interacted with, and then also where people have been told to self-isolate. That's not always something that someone who doesn't have a home can easily do or is used to doing. So are there measures in place to ensure that they do so?
So that was a lot of questions. So if I miss one, you'll have to remind me. Yeah. So again, as Dr. de Villa said, I can't share individual details about this individual. What I can tell you is that while they waited for their test result, they were residing in our isolation center, which is as it should have been. We have created transport, so if an agency identifies a person that they're concerned about, we've coordinated transportation so that we can safely move someone to get a test and then safely move them to our isolation center while they wait for their results. So I'm confident that we've taken the steps necessary. We were hoping to keep this out of the shelter system for as long as we could, and now we're moving to steps to obviously to contain it. So we'll be working very closely with public health as they conduct their contact investigation, determine whether or not there are other people of concern, and then following those same procedures and protocols.
So you missed two of the questions there, if I can just react.
Okay.
Chances are this is not a travel case, so then is there an investigation into who the person may have interacted with, which I'm guessing could pose challenges given just the nature of their lifestyle? And second of all, in quarantining the person, someone who is not used to being at home or not having a home to go to, are there steps in place to ensure that people in the shelter communities do remain in quarantine?
So we will not be conducting the investigation. We will be doing that in partnership with Dr. de Villa. We do keep very detailed data of people's movements through the shelter system, so we anticipate fully being able to cooperate with Toronto Public Health's investigation. And we're also working very closely with our partners at the Inner City Health Associates to make sure that our isolation program is an appropriate program for people experiencing homelessness, and obviously is appropriate in a way that encourages them to remain while we wait for their test results.
Ellie Cooper from News Talk 1010.
And my first question is for Dr. de Villa, please. Dr. de Villa, we've been hearing that there have been indications of community transmission, community spread. Are you confident now in saying that that is absolutely what we are now dealing with, as well as, from travel?
Yes.
Okay. Thank you.
You're welcome.
And my next question is for Gord, please. Your member, you said, started to show symptoms on the 19th, so we have to assume that he or she was carrying the virus for about 2 weeks. So are there any other members of the paramedic service that are now in self-isolation as a result, and if so, how many?
So just to clarify, the paramedic contacted us on March the 19th. And I can't go into any other details. That's public health will provide the response in terms of the following the process. So as a privacy respect for my member, I won't go into any further details.
Okay, and are there other members though in self-isolation?
As I said, I won't go into any details.
Okay, so Dr. de Villa, can you comment on that?
Sorry, just to be clear, the question?
If there are other members of the Toronto Paramedic Service in self-isolation.
Well, I would imagine that there should be some. Some might have returned from travel in the last 14 days and maybe home isolating as a result of that, certainly. So,
but in connection with this case that has been announced today, are there members in self-isolation? And if so, how many?
We'll have to let the investigation proceed. Happy to provide you with details when I've got them.
Thank you.
Another follow-up, Mark? Go ahead.
Question for Chief Pegg. If you could elaborate on something you mentioned earlier in your opening comments, shelter or shelters at undisclosed locations. Could you elaborate, please, on whether specifically who are those shelters for, and again, why are they being kept undisclosed?
I'll actually let Mary Ann respond.
Sure, please.
Thank you for the question. So there are two specific programs that we have opened. As I spoke about before, there is an isolation, actually there are three. There is an isolation site for people who need to self-isolate for 14 days because of travel. There's an isolation site for people who are awaiting test results that have some reason to suspect that they may have COVID-19. And then the third site that we've secured today is a site for people for COVID-19 recovery. So, I mean, obviously, you know, these are for people's privacy. You know, even with our regular hotel programs, we don't disclose the specific locations of those programs. And so I think it's just in respect of people's privacy. You know, the most important thing is that they be allowed the time to recover.
Oh, sorry, and just to clarify, all three of the special shelters you mentioned, all three are going to be undisclosed locations?
Yes, all three.
Thank you.
Last question.
Sorry. Yep. Matt Bingley.
Dr. de Villa? I know we've been dealing with a lot of serious stuff this week. Had a chance to talk to the members of the press gallery, and we all collectively wanted to ask you this question based on social media. How many scarves do you have?
I'm not sure. Many.
Fair enough.
But I'm happy to take any suggestions if you have particular patterns that you'd like to recommend.
We'll leave that to Twitter.
Okay.
Thanks very much, everybody. Have a great weekend. There is no planned briefings for this weekend. We will update through the weekend, though, with numbers as they become available. Stay healthy. Thank you.